I'm Mary Ann Tolliver, and I am the Director of Aging and Navigator of Residential Supports. I've been with the agency for 37 years. I started off working in residential, moved into the director position for 20 plus years, and then moved into this role within the last couple of years. So I have a lot of information on DMH type services. And the one thing that I always share with families is that it's most important to start in looking at a plan. And that should always be your first step. So you know the direction that you want to go and what you want for your family member, because it's a complicated topic. It's not easy to get residential supports through the Department of Mental Health, but not everybody needs that level of support. So you really want to look at what is most important to you and your family member, and what is your vision for a good life. Know what the wants and needs of your family member are, and the level of support that they need. Is it support that's 24/7, or does your family member have the ability to be able to live in their own apartment with fewer number of support hours? And know what those goals and what areas that you really want to focus on and the support that your family member needs. I know there's some people who need level of support that's kind of sandwiched in between those two, and something I know that that we're working towards and trying to come up with some new ideas and opportunities. So looking at the environment that your family member, what you want them to live. Is it an apartment? Is it a house? Is it a condo? And who are they going to live with? That's a really big piece. The type of personality of that individual who they'd want to live with. Is it somebody that they've known in the past and have always wanted to live with? So really taking a look and real rumination on what is most important to your family member. Safety and security. We know that that's always first and foremost in everybody's minds. And it's in so many different ways. I think remote monitoring for people who have opportunities and have the ability to be able to live more on their own and more independently, having remote monitoring at nighttime, which is kind of like a system that's there if somebody needs something, so that they can then tell somebody else to come in because your family member needs some help. Something I know that's just a quick little piece of what that is, but it's something to kind of keep your mind on, to know that it's out there. Community access and transportation is something else to kind of keep in mind. And the other thing is, sometimes it's really easier to say, this is what I don't want if my family member is moving. So looking at that and knowing what those pieces are really important to identify, so that as you start planning, it's important to be able to identify what all these goals and wishes are. What services look like from the Department of Mental Health, and how to try and get that funding. That funding that we're specifically going to talk about today is that there's several waivers that are available in the state of Missouri. The Missouri Children with Developmental Disability Waiver, Partnership for Hope, Community Support Waiver, and Comprehensive Waiver. Comprehensive waiver is the only waiver that supports people in residential living. And the other supports, such that come with the community waiver, also come with the comprehensive waiver. Here's a list of it. Kind of go over it briefly. There is no cap on the amount of money that can be spent, but there is a need to justify what it is that you're wanting and the services that you're wanting to receive. So it's not a carte blanche. You can spend whatever you want, but there has to be a real need that is shown for any of the services. So the ABA services, which is behavioral supports, assistive technology, career planning, community integration, community transition, day habilitation services, jobs development, OT, speech therapy, crisis intervention, transportation, as I said before, residential, and there is some respite that is provided. So what are the steps to access the waiver? First off, you have to have Medicaid. If you don't have Medicaid, you need to apply for that. And here is a website that you can go to that takes you directly to an application to fill that out. And when you are filling out that application, you want to make sure, and sometimes people get caught up on, should it just be my family member? Do I need to put some of my own stuff in there? But it's just about the family member who's applying for Medicaid. It's their information, not anybody else's. Oftentimes people say, well, I've applied, but then I've had to reapply and I don't really understand. The one thing to know is that with Medicaid is that if they are sending a letter out after they've received your application, they will, if they need more information, they're going to tell you what they need, and that there's always a timeline that is put with that. And you want to make sure you meet that timeline, because if you don't, then it is done and over with, and you'll have to start the whole process over again. They're very strict on what those timelines are. So it's something just to kind of be aware of. So once you receive Medicaid, you're going to want to contact the St. Louis Regional Office, and that's for St. Louis County, St. Louis City, St. Charles County, and Jefferson County that we mostly deal with, and the telephone numbers that are here. If you live in another part of the state, you would want to find out which regional office you are under and want to apply to get that support coordinator and services through the St. Louis Regional Office. So there's an application one that you have to fill out to say, I want services, and then an application to actually get a case manager. So it's a little bit of a process, but to be able to request services, you will have to have a case manager, because the next step is that you will need to have an individualized support plan, which I will refer to as an ISP, and probably what most of you are terminology that you're using. So that individualized support plan is going to identify why you need services and what it is that the type and the reason why you need that service. So it has to be justified to get that waiver. They will also have to have a MOCABI assessment on file, and the support coordinator will complete that MOCABI for you and work with you and your family member to complete that inventory. MOCABI stands for the Missouri Critical Adaptive Behaviors Inventory. It's a lot of information about the type of the supports and what those supports look like for your family member. And then there is a PONS, so I call it a PONS score. So what it is, it's a prioritization of need. So the department has to have some kind of scale on which to determine who's going to get the services. So they use this priority of need assessment, which you want to make sure that when you sit down with your case manager to do this, that you really give a realistic picture of the support that your family member needs. You never want to sugarcoat it. You want to be just exact, that this is what they need. Can your family member watch TV and do that independently? Well, if they can't if they need help, like picking up that remote control and changing the channel, then they're not fully independent in doing that, that they need some support to be able to do that. And that will look at what it is that your family member is needing. Also, the other piece that's on there is what your situation is. So if you have your family member, you're living at home, and you're having issues with health and potentially having issues with maintaining a job because of services and because of the care that you're providing your family member, could be reasons that's going to increase the score that you receive through that assessment. And the score is between 1 and 12. In St. Louis County right now, most people who are receiving those services, I'll say all people, is because they have a score of a 12. And I know that, there's a lot of people who need services and who want services, but they have to be able to decide who is going to get the money And that is based on what the needs look like and who are going to be in the most desperation of situations. Once you have applied for that waiver, then what happens? And what kind of services do you want? So you're applying for it, but you want to say, this is the kind of service that I want. And that there's a shared living model, which includes a host home, a companion home, an ISL, which is an individualized supported living, which I will try to go back and forth between using ISL and individualized supported living. There are also group homes and self-directed supports, and I'll kind of go over each of these. So the shared living models, there's a host home and companion model. And the biggest difference between the two of those is who owns the home or who has renting the home and whose name it's under. So under a host home, your family member would be looking at living with another family or a person, which we call a host family, and it's in their home. You would have an agency who would help administer a home study, and that agency is going to support to make sure that everything continues to be in place for your family member. So the host family is responsible for maintaining home ownership, homeowners and renters renters insurance, and you will pay rent to the host family for the portion of expenses, while DMH is paying for the staffing and the administrative costs for those services. So let's say that it's not working out and there's a termination of services. At that point, that means that your family member would be moving out of the home because this is the host family's home. And if it's not working, then your family member is the person that moves. So in a companion model, the companion would come and live with your family member at their apartment or their home. And you also would have an administering agency that completes a companion evaluation. And the individual, so your family member is responsible for maintaining that homeowners or renters insurance, and the companion will split all the expenses. Those will be cut in half, but the administering agency will cover the cost of the room and board for the companion through the Department of Mental Health. But the difference here is that if this isn't working out, your family member stays in their home and the companion moves out of that home. So the individualized supported living, which I'm going to talk about the ISLs and group homes, and then I'm going to tell you a little bit about what the St. Louis ARC does and how many people we're supporting and kind of what that looks like. So supports are provided in the individual's home, and the individual chooses, when I speak of individual, that's your family member, choose where to reside, with whom you want to live with. The residence must be owned or leased by at least one of the residents or by the family or guardian. The individual covers their own room and board expenses through their benefits checks, whether it's SSI, SSDI, or if they are in a job and they want their earnings would then go towards that rent as well. DMH covers all of the staffing, the health and safety needs, and the administrative costs. That's what that funding from the waiver is paying for. And health and safety is a very, very big thing. That's why we have nurses that are available who come in and check on each person on a monthly basis to make sure that they're feeling well. And that is another piece of oversight that's really important within this piece. Up to 4 individuals can live together in this model, and the ISL has to be the least restrictive environment possible for the individual. So if somebody is really able to live out on their own and could live with 10 to 12 hours of support, then that's where we would want individuals to be putting their energies towards living in that type of environment, so that people who need a higher level of support are actually getting the funding that they need as well. Group homes. Group homes is an arrangement. It's all very similar to an ISL, but the biggest difference is that there are four or more people who are living together. The home may be owned by the agency, but I will tell you that none of the homes that the St. Louis Arc is supervising and providing these services in, we don't own any of the homes, nor do we want to. When services are terminated, the individual is required to move out of that home. So the biggest difference between a group home and an ISL, one is the number of people who are living together. In an ISL, it cannot be more than 4. It can be 4 or less. And the other piece is a budget. The budget for the ISL for all of the services, for the staffing and the nursing, is all developed for each individual person and is determined by the supports that are needed for each person. Some people may need more one-on-one service, or could provide 2 staff to, or 1 staff to 2 individuals or 3 individuals, and that they're safe in that type of environment. Though sometimes they may need to have more staff, and that budget can fluctuate according to what the needs look like for each person. In a group home, the budget is predetermined. It has a set price of this is how much it is. In our group homes, it's about $209 a day for someone who has basic services that they need. And there's a kind of a scale that if somebody has a higher level of support need, on a scale between 1 and 5, those people who have 4 and 5s are probably at like $315. Those are the 2 rates, and there's no fluctuation in between. So that's kind of the differences. At the St. Louis Arc, we are providing services to about 117 individuals. And of those individuals, we have our location at Dogtail Circle, which people in the past referred to as Rainbow Village. Rainbow Village is the owner of the homes, who is now Promise Community Homes. But what you really want to know is that the St. Louis Arc is providing the services to each and every one of the people who live at Dogtail Circle. And at Dogtail, we have group homes. We have 9 group homes, and we have 3 ISLs. And in the community, we have 14 ISLs and 2 group homes. Currently, we have 4 openings out in the homes in the community. 3 are at group homes and 2 are at ISLs. So in those ISLs, most of those have potential for 3 people to live in them. The group homes at Dogtail, where there are, we have 4 openings at Dogtail, and 4 of those are for women. So that's kind of where we are at right now and the services that we provide. With group homes and ISLs, they're run very similarly. It's the number of people who are living there and the budget that is totally different. People who live in group homes, we want them to get out into the community and do the things not just at the home, but getting out and living life and living the best life that they want to is the direction and the goal. So ISL and group homes are similar, but different when it comes to the funding.
Marianne, we have several questions.
Sure.
So the first one that came in, my son is very high needs. It seems like ISLs are minimally staffed and the staff don't have special training, and just 1 staff overnight for all the residents. Can you speak to that?
Generally, there are probably 1 staff who does the overnight. In some homes, it's determined whether that needs to be an awake overnight or a sleep overnight, which we call more of a restful overnight because nobody really sleeps really well. But I think it's really important to know the level of support that your family member needs. And if there is a higher need for behavioral supports, there are agencies who I think are more equipped to provide that type of support and have more of the education available for the staff and the training and the resources for them. And then there are other agencies who don't have that, may not be their expertise. So I think you have to be very careful on the agencies that you would be talking to for those level of supports.
And when you mention individuals living in a home together, is that 4 individuals living together per house, not per room?
Yes, that's per house. Most of our homes, and I think most agencies that we have private rooms. I will say that our group homes at Tel, that there are some of the homes, there are 6 people who live in those homes, and there are 4 private rooms and 1 shared bedroom, and they also have their a connected bath to that. So not everybody can live together in a room. But I think for the most part, what agencies want to do and what we really want to do is to assure that people share a home but have their own individual bedrooms.
And then regarding funding, can one reactivate their case through the regional office?
Can you say that one more time, Brian?
They were wondering if you could reactivate your case through the regional office.
Yes, you can, but to have an active case manager through the Department of Mental Health, you have to have active Medicaid. So if you have active Medicaid, yes, you can. Otherwise, I think there's a case manager specialist that you can call and get some answers to questions that you might have, but you would not be assigned a particular case manager or support coordinator for follow-up on an annual basis.
And Marianne, 2 questions came in from Facebook Live. What are the age for the openings for the women at Tel Circle?
The average age of people at Tel is about 57, though we are looking at this location kind of mixing that up a little bit. Younger people, I would say anywhere between 36 and older. So otherwise, I would not put anybody who's in their 20s at Tel. I just think that the community there is older, and just that support is just a little bit different. Not to say we wouldn't do it if it was the right fit.
And then are there any options to pursue residential supports funding for individuals on the community waiver? We have been told comprehensive is next to impossible to get if there is any family support option at all. How does a person work to live outside the family home if not on the comprehensive waiver?
That's a good question. Not one that I have a really good answer for, I don't think. The other waivers, that is not something that's included. Residential funding is not included in the other waivers. I guess it could potentially in ISLs in the past. Not everybody needed to have 24/7 support. So I think the first thing is to be eligible for it. And that's going to be generally, I know this sounds horrible, but it's dependent on if somebody's home is no longer going to be viable for them to live in. So generally the family member that they're living with, that either they have to move because like into a senior living, and their family member can't move in with them. So therefore their family member is going to be homeless, and or the health of the family member is not very good. Though there are some people who have high support, behavioral support needs who are receiving that funding. Now, another type is the self-directed supports, which I know a little bit about. I know it's founded on the principles of self-determination. So it's what the individual wants and needs, that the individual has a designated representative, that they're bringing in employment. So you are looked at as the employer of bringing the staff in to work with your family member, and that you are the budget authority. So there is a budget that is determined, and you can then decide how that money is going to be spent to meet the needs of your family member. This authority allows individuals and families to hire, train, schedule, and fire the employees that you have working for you, and to utilize that budget again the way that you see that fits the needs of your family member. That you have to follow the laws by the Department of Labor, the Missouri Department of Labor, and Industrial Relations. And it does include the components of person-centered planning. So you're planning on what's most important for your family member, and with their thoughts into what they want their life to look like. Individual with a family member controls the budget. You can hire a support broker to help you out with these services that you are managing. There is help for financial management, that there's a backup plan and quality improvement. So self-directed services that are self-directed are considered as a personal assistant, medical personal assistant, behavioral personal assistants, a community specialist, or a support broker. That support broker is hired by you to provide you with information and assistance that helps you self-direct the supports that are coming in, whether that's to help out with some training, to help bring people in if there's the ability to do that. For whatever support that you might need, you can lean on this person to help you manage what's happening with using these services. The Public Partnership LLC is the agency that assists in the self-directing your services, and that PPL will assist with tasks such as facilitating the caregiver background checks. You want to make sure you've got a background check on anybody who is going to be supporting your family member, to help you with records and retention of everything that rules and guidelines that you have to follow that are given to you, process timesheets and issue paychecks. They'll withhold and file employer and caregiver related payroll taxes, ensure workers' compensation and unemployment coverages are there, compliance with federal and state rules and regulations, and provide spending summaries. And that there is an online access available for those spending summaries. A lot of reporting that you have to do and manage as you control and self-direct the supports. Residential options. So once you kind of decide which of those areas that you want to work within and that best fits the supports that your family member needs, you are going to work with your support coordinator, and your decisions will be included within the ISP. And that request for funding will be outlined in that ISP, which your support coordinator should write and really address and paint a picture of why these services, why you are in need of these services. And then it goes to that ISP goes to the DMH Utilization Review Committee, and they will look at that along with your priority of need score to determine whether or not your family member should receive the waiver. So the administration will provide approval for funding. And once that has transpired, your individual's name and information will go into a database. We call it consumer referral database. And then all the different residential providers see that information about your family member, what the support needs look like. And those agencies will then say, yes, I'm interested. That information goes to the support coordinator, who will then let you know who has expressed an interest, and they will encourage you to meet with the different agencies. So one, that you know what the philosophy of the agencies are, the level of support, what their management systems look like, and what their training looks like. You want to ask all those types of questions. And then you want to go out and see the different homes of where there is an opportunity for your family member to live, meet the people who are living there. So they call that a meet and greet. So it helps you explore your options. And I encourage all families to make sure that you are exploring your options all the way through. So once a provider is chosen, a house and a roommate have been chosen, a transition meeting is then scheduled. with the provider and residential team. So that transition meeting, you will talk about your family members' healthcare needs, the type of medications they might be on, why they're on those medications, what their financial status is, what type of supports they need, what that looks like. They'll ask whether or not, you've had the opportunity to have a meet and greet, and it's more than just one meet and greet. You want to make sure that you have the opportunity to go and meet the people and the staff several times before you make a decision potentially, and or after you've made that decision, that's the agency that you want to go with. You want to continue to have those meet and greets over time. So the transition meeting, there will also determine kind of when you're going to be moving, who's going to help move. Do you need to rent a U-Haul? What kind of furniture will you be bringing? What will you bring to the home? So they look at the full picture of what needs to happen for the move to be successful. So that transition plan is then written by your support coordinator. And if it's an ISL, a budget will be prepared by the provider agency and or provider agency. If it's an ISL, I think it's probably a little bit different if it's one of the other two. I'm not really sure how the companion model moves, but I would think that it's very similar to this, with the budget being prepared. And then that is submitted to the utilization review committee. So then they'll give their recommendations to the director, and then it's determined by the director that yes, that approval is given. And then once that approval is given, a move-in date will be decided between the family and the provider agency. How long does that process take? Well, it really depends upon your support coordinator and how efficiently the utilization review committee is running, and how many different things that they're looking at by that committee. I would say that it takes 3 months. It could be 2 months if that support coordinator is really efficient in writing that plan. And we know that support coordinators have so many people on their caseload, and that sometimes there are a lot of things that get in the way. But we really hope that once you have that transition meeting, that within the next 3 weeks that plan is written and then submitted into the utilization review committee. After that decision has been made, that yes, that you have the approval and a date, you move in 30 days. During those first 30 days, there's a lot of assessment that is happening with the agent, with the team members and your family member, really getting to know each other and discovering what their goals are. And there will be a meeting 30 days afterwards to determine, is this a good fit? The things seem to be working well. And what are we going to do for the rest of the year for the ISP, so that there are specific goals that are put in place. The support coordinator will also do a monthly monitoring with the agency, and they are there to ensure that the health and safety needs are being met. They look at water temperature, medication administration, access to the community, cleanliness of the house, and to assure that other personalized supports are being delivered as are outlined in the ISP. So the services that you're getting for that 24/7 is to really ensure that your family member, one, has the support that they need, whether it's helping them get up in the morning, preparing to go to work or to a day program, or if they don't go to either one of those programs, to kind of get their day set. Medication, all the staff are at the St. Louis ARC are all trained on medication administration. It's a 18-hour course that they have to really understand what medications are for, and know what the side effects that they'd be looking for if they're administering that medication. So we threw a lot of information out at you. You know, the services that people are wanting for residential. I know that the need is bigger than what we can provide, and what the Department of Mental Health and the state can afford to pay. And I know that we are looking at other avenues for those in between and trying to come up with solutions. I know that there's a group of families who are meeting and trying to brainstorm and come up with other opportunities. What other questions are out there?
There was a question about which other agencies provide similar residential supports.
Oh, there's a lot of agencies in the area between Willows Way, Easter Seals Midwest, Community Choice, Judavine, Community Living, BIS. There's a lot more, but those are the top ones that are coming off my head.
And the question just came in, what age is most common for family members to get shared living?
People out there getting funding raise an age between, I'd say, I've seen people out there who are 16, 17, 18 who are getting funding all the way through the gambit of, you know, older individuals as well.
How much access do family members have?
Good question. The way that things are set up is that we want families to be able to have the relationship that they want with their, as a family unit. And we have people who go home every weekend, who go out to dinner with their family members throughout the course of the week. Sometimes people will spend the night at their family's house. Friday, Saturday, come back on Sunday. It's really very much a family decision as to how that looks. But coming into the home is definitely, you know, to have dinner or a party, a family gathering are all very appropriate. Thank you for being here and spending this time with us. We're hopeful that the information that you received met your needs, and we look forward to working with you in the future.